A very healthy and happy afternoon to all the exciting parents out there. I, Dr. Vivek Jogani, a pediatric and preventive dentist and pediatric orofacial myotherapist from Mumbai, in association with BabyChakra, welcome you all today on today's most exciting topic, mouth breathing in children. Well, before going into one specific habit, let's understand the abnormal oral habits which a child most commonly has. Few of them are thumb sucking, lip biting, mouth breathing, and tongue thrusting. All these habits have various deleterious effect on the growth and development of the jaw bones, including the face, the cheek muscles, the facial outline, and everything. It basically, disturbs the growth and development of the face. The most common ignored habit by the parent is mouth breathing, and hence the topic for discussion today would be mouth breathing. Now, most of you would be, very clear with this uh, cartoon character Chota Bheem. Now, when you see this, I have selected this picture in such a way that on one side you have all the healthy and happy faces, including Chota Bheem and Chutki, who are projected as good characters, whereas on the other side we have the naughty characters in the form of the two notorious ones, Kalia and so on. Now, because you all are, my target audience is parents today, so you would relate more common with Chota Bheem. And over here, if you see the facial outline that the characters have been given by the creators of this theme, Chota Bheem and Chutki, if you see their facial outline is very symmetrical and balanced with the body proportion. Whereas on the other side, if you see the naughty characters, you see them, one of the character is obese and the other ones are too lean, the lower jaws are not developed, they have abnormal facial appearances, and if you have actually seen the characters, then Kalia is also shown to be snoring. So if you understand this one basic picture of healthy faces versus the unhealthy faces, the topic of presentation is for you today. Now, when you Google out mouth breathing, the first thing that Google shoots out in less than 0.55 seconds is that it is a mouth breather is nothing but it's a noun, and it is a noun given for a stupid person. Further going on to Wikipedia, when you further analyze what mouth breathing, Wikipedia says it is an abnormal pattern of breathing, and currently the Macmillan Dictionary defines the term mouth breather as a stupid person. No offense to anyone, but this is a slang that has been used in the English literature for a mouth breather. Now, before going on to the further presentation, I would want you all to keep the pen and paper. Uh, uh, I would want you to, before going on to the further presentation, let's have a small questionnaire. So I request the parents to have a pen and paper handy to answer a few questions. Now, while your child is sleeping, does he sleep with his mouth open? Okay. So when your child is sleeping, does your child sleep with the mouth open? Does he snore at night? Is there any chances of bedwetting that is happening on and off in your child? Does he keep tossing and turning in the bed? Does he stretches his backwards, his head backwards, wakes up frequently, टूटा हुआ sleep, नींद बराबर नहीं होना, करवटें बदलना बार बार, having nightmares, grinding his teeth at night, having trouble to wake up and there is saliva on the face in the morning, and so on and so off. If any of this question is yes, the answer to any of this presentation questions is yes, the presentation is just for you. Yeah. So this was one set of questions. The next set of questions that we have for you is, while your child eats, does he or she stop to breathe through the mouth between the mouth holes? यानी कि खाने के बीच में बार बार सांस लेने के लिए निवाले बीच में दो निवालों के बीच में बहुत सारे ब्रेक्स लेना. Does he stick his tongue out while swallowing in the form of like this, और बहुत ज़्यादा पानी पीता है खाना खाते वक्त, or does he make a lot of noise while chewing food? Does he take a breath when drinking, tightens his lips when swallowing, wrinkles her chin when swallowing, and so on? If any of the answer to this question is yes, the presentation is for you. While a child speaks, does he or she speak very fast, very slowly, or he, stops in between to gasp for air? Is there any lisping in between? If any of the questions answered is yes, yes, again, the presentation is just for you. While your child is sitting on a sofa in front of a television or in the car, does he or she put his mouth in, put the things in his mouth, such as toys, sleeves, pencils, या फिर fidgetate करते रहना? Does he suck on his lips? Has he have a tendency to keep the lips open? Do you usually see the tongue in between his teeth, rest his hand on the face in this format, or breathes through his mouth, makes noise while breathing, particularly snoring type of noise or a hissing noise, and has a very short attention span? If any of the answer to this question is yes, yes, this presentation is for you. So from each category, even if we take one positive or a one yes answer, it means your child is having 4 of the cardinal features of mouth breathing. Now, before going on to what are the detrimental effects of mouth breathing and what mouth breathing actually is, let us understand the difference between mouth breathing and nose breathing. Nature has designed the nose to breathe. Okay, now this is the maxillary sinus if you see on the screen. So nature has designed the nose to breathe air, and when you're breathing the air through the nose, the air is warm and filtered. It is filtered from the dust, allergens, and pollens, and that filtered air, that warm air, when it reaches the lungs, it is utilized better by the body. Whereas when you compare it with mouth breathing, when you have to breathe through the mouth has, the nasal passage is choked and the child starts breathing through the mouth. A lot of dust and allergens enter the body. Because a lot of dust and allergens enter the body, because while breathing through the mouth, the air is not warm, the air is not filtered. This air, which is with a lot of dust, allergens, and pollens, results in inflammation of the protective mechanisms of the body, including the tonsils and the adenoids. And these tonsils and the adenoids, they have a lot of effect on the growth and development of the small individuals. For such common cough and cold, you rush your child to the nearest ENT or a pediatrician, and he would recommend some kind of steroids and nasal clearing medications without knowing the underlying cause of mouth breathing. So first you have to identify whether your child is a mouth breather or not, and accordingly you have to treat the condition. Now, when we come on to genetics versus epigenetics, when we ask the parents that is your child is a snorer, your child breathes through his mouth and is snoring at night, the parents often say, डॉक्टर साहब ये तो हमारे जेनेटिक्स में है, इसके पापा भी स्नोर करते हैं, इसके दादा भी स्नोर करते हैं, so everyone in our family snores and according to them it's normal. No, it's not normal. Genetics does not get snoring in the baby. Genetics will determine the size, the color, the shape, and so on and so off. It is the epigenetics, or what is epigenetics? Epigenetics is nothing but the environmental factors that act on the genetics. So let's say एक ही खानदान में, एक ही family में दो बच्चे हैं, let's say both are twins. but because of their eating habits or because of their exercise, एक बच्चा बहुत exercise करता है, एक करता ही नहीं है, तो there's going to be a discrepancy in the height. One would be a heightened individual, one would be a short individual, and that is nothing but epigenetics. So you should not conflict, or you should not mix up genetics and epigenetics. uh, the child having facial features of the parents may be genetics, but if you give good environmental factors, the good epigenetics, then there is no question that the child will all should also be snoring. And trust me, snoring is not healthy. It impairs, mouth breathing impairs the quality of life, and you are disturbing the quality of life. Because of mouth breathing, the child's growth and development is shunted. The growth and development does not happen in the right direction. Why could be your child breathing through the mouth? Have you ever given a thought to this? Yes, there are a variety of factors. One of them is a child could be breathing through the mouth because of obstruction. Obstruction could be because of nasal polyps, naak ke andar. Sometimes there are polyp formations. There could be adenoids or tonsils. But if the adenoids and tonsils go untreated for a longer period of time and the child starts breathing through the mouth very often, then he may get converted into an habitual mouth breather. What are anatomical mouth breathers? Anatomical mouth breathers are the breathers, those who have, short upper lip, or because of a C-section baby or a cesarean delivery or a low birth weight and a pre-birth, preterm. Sometimes they are shifted to the NICU, PICU, intubated, and those gadgets and cords hamper on the growth and development of the facial muscles and the development of the jawbones. So the most important causes are obstructive, habitual, and anatomical. Now, to this, I have added one important factor is refined diet. Given the today's scenario, when we say refined diet, because of packaged foods, the soft, cheesy material that it is readily available in the form of noodles, pasta, chips, cookies, biscuits. Nothing is that the child has to put an effort on eating. So this refined diet results in inability to put the orofacial muscles to function. That is the जब खाना खाते हैं तब कुछ एक्सरसाइज होती है, जब हम सैलड खाते हैं तो चबाना पड़ता है. But if you're having a refined diet, you don't have to do all that. And that is the reason why your babies have small face and more teeth. And that is the reason they have crowding in the teeth. And then they go in for very commonly for braces. This is because you're not allowing your child to have raw and hard diet. If you see the forefathers, if you see बच्चे के दादा दादी को, उनके face structures, उनके jaws बहुत wide होंगे, and they'll have all the set of teeth without any braces. That is because they were not on refined diet. Now let's come on to the effects of mouth breathing. If you see this mouth breathing, it has a lot of detrimental effects on the growth and development of the child's face. Let's take an example. How many of you remember Fido Dido? Fido Dido is again a cartoon character which was created when we had these advertisements in the early 90s of 7 Up. तो उसमें वो जो टिपिकल ऐसे वी शेप फेस वाला बंदा जो था, that is nothing but a Fido Dido face or an adenoid faces. So what do this mouth breathing results in? An individual who has been breathing through the nose, the facial development is normal, and therefore he develops in a smart and a beautiful face. But a child who has been breathing through his mouth because of various underlying features, it could be because of repeated episodes of cough and cold, anatomical obstructions, or that could be because the child is habituated to breathing through the mouth, or some allergens which are constantly causing this. So in that case, they develop into a long and narrow face. The narrow nose, the nasal passages do not develop. There is let me share the screen with you. Yeah, so they have long and narrow face. The nasal passages do not develop from this side. The upper lip is short and flaccid. It is an expressionless face. So I hope the screen is visible with you, or let me do a share again. So we're sharing this presentation. Yeah. So then there is an expressionless or a blank face. You know, the child will usually have a blank or a dull appearance, and there's flaring of the incisors. मतलब कि in local language Marathi में बोलते हैं फावड्या सारखे दात बाहेर पडतायत. And then there is dryness of the mouth. Because there is dryness of the mouth, the corners of the lips are chapped, and especially in winters the child will have scaly lips. And because of the drying of the teeth, very often they are more susceptible to decay, especially in the front teeth. Now, when we say the profile of a mouth breather, the profile of a mouth breather, when you see this picture, I'm gonna demonstrate on myself as well, and make you aware of things. But first, understand that the child has a bad posture because of the humping of the back, a narrow face, a smaller airway, receding chin. Receding chin is nothing but that the lower jaw, यानी कि mandible, जो नीचे का हड्डी है वो अंदर रहता है, वो ज़्यादा अच्छे से डेवलप नहीं होता है. Crooked nose. Now, if you take your child's face, or if you take a photograph of your child and draw a midline through the center, you will realize that both the right and the left are not symmetrical in nature. And the child will usually have puffy or tired eyes, and chances of these kids having, lazy eye is very common. So uh, when I say humping of the back, it means that the child is sitting in this format with the lips open. Yeah, so with the lips open, a humping of the back, the collarbone has come down, and so on and so forth. So now, yes, posture is not just related to our backs, and I repeat, this statement is very important for you as parents to understand that the tongue is not attached to the body. I repeat, the tongue is not attached to the body, but the entire body is attached to your tongue. So a healthy oral posture means placing the tongue on the palate, maintaining a lip seal, and exclusively nasal breathing. So when we, am I audible now? Yes. Um, okay. So if I had to compare, if I had to explain this, when I say that the entire body is attached to the tongue, is because tongue is not a small muscle. It is an organ in itself. And because of the attachment of the entire body to this organ, such as the tongue, the entire posture gets affected. Now, what is the correct posture? Say the alphabet N with me. N. I repeat. Repeat the alphabet of A, B, C, D. Repeat the alphabet N with me. N. Now, when you say N, where did your tip of the tongue end? It just ended in front, in just behind your upper front teeth on the inner side, on the palate. And that is nothing but that is the home position of your tongue. That is the position where your tongue is resting, or that is the parking lot for your tongue. Now, when your tongue is touching that posture, it is touching the entire palate. So, पूर्ण टाळूला, touch करायला हवंय. So it should touch the entire palate. And that is what we mean correct posture. Say the alphabet N. Where the tip of your tongue is ended, there your tip of the tongue should be there, and then you swallow. Okay, so the correct posture is whenever your child is sitting on a chair or on a sofa or wherever, he should be sitting with his lower back. He should be sitting with his lower back touching the back of the chair so that his body is upright. This is more important in a given scenario of Corona times, or COVID-19 pandemic, where you have online schooling and the child is totally hooked in front of the gadgets, or cameras for the online classes, and then over a period of time they start sitting like this, they start sitting like this, and when they're sitting, they should not be sitting this way. So all you have to teach, or give a small cushion behind the lower back so that the lower back is straightened. Explain the child that he should be sitting upright. The camera or the gadget should be at the eye level during the online schooling. And more importantly, ask the child to have sips of water in between the classes. Even during the classes are going on, the lips should be closed, and you should keep a constant vigilance on your child. This is one child who had, inquired, one parent who had inquired with us from Kuwait, asking that, is there any, the child was almost 12, 13 years of age, and he was bedwetting almost 3 to 4 days a week. And the child parent or somebody, got connected with us, and they understood that this was associated with bedwetting. And that is why the parent had inquired that, is there any correlation? Yes, there is a correlation between bedwetting and mouth breathing, and one of them is WOB. It means that there is something called as the atrial natriuretic peptide chemical, and when these chemicals are inhibited, they inhibit the urination during the sleep, and because this chemical is masked or inhibited, it can be linked to sleep disordered breathing. Kids breathing through the mouth, that is, the lips are not always closed during the day and night, has been linked to skin rashes in the form of childhood eczema and atopic dermatitis as well. So mouth breathing has a lot of detrimental effects. Now, you as parents, very often you say, I'm speaking since last, 20 minutes about mouth breathing, mouth breathing, mouth breathing. What is the treatment for mouth breathing? Understand, mouth breathing is not normal. It is abnormal. So if you stop something which is not normal, that itself is the treatment. So the earlier you intervene, the faster and the better the results you get. So the treatment is remove all the hindrances in the path of natural growth, and the growth itself will be the treatment. So if you stop the mouth breathing, the growth of the orofacial muscles is itself the treatment. Visit your pediatric dentist to know better about mouth breathing. Trust me, nobody would know more better than your pediatric dentist about identifying mouth breathing and treating mouth breathing. Your pediatric dentist is the one who can have informed referrals with the ENT depending upon the need, a physiotherapy, a speech specialist, or they themselves are very well trained to take care of mouth breathing. And mouth breathing does not take a lot of efforts. It takes time. The earlier you intervene, the lesser the time, and the faster and the better the results are. I'm going to share 1 or 2 clinical pictures and cases that we have treated as well. Your pediatric dentist can also inform you about certain exercises, and this exercises, and this exercises could be, the best one that you can do at home is nothing but, let me just show you. We have, okay. So a lot of questions have been popping up. Give me 2 minutes and I'll get back to your questions. So when we have, when I say exercises, there are simple exercises which the child can do at home. The best one is blowing balloons. When your child is at home, they like to do some activity. The younger the child, the more inclined towards balloons. So blowing balloons or playing mouth organ, that is the instrument that Kishan Kanaya plays, and or playing a flute, or the another exercises doing pranayam. The parents can participate with the child to do some pranayam exercises, mother, father, and the child sitting all together and doing pranayam, yoga therapies, reminder therapies. So when we say reminder therapy does not mean nagging the child. Do not nag your child, close them out, shut them out, do this, do that. They won't like it. It will have a lot of psychological impact on them. Understand your child's need. Understand that there is some underlying etiology which needs to be corrected. Understand that he needs some mental support as well. So make it in an encouraging format. Approach your child in an encouraging way. Do not just, nag in front of his friends and relatives that, just shut your mouth, stop breathing through your mouth, don't do that. It will have a lot of detrimental effect on the child's development. Instead, you can decide a secret code. Say, for example, if your child's favorite sports star is Virat Kohli, so you can just say, hey, Virat is around. So when you say that, the child understands that he's breathing through the mouth, and then he should be stopping to breathe through the mouth. But if this reminder therapy does not work, then the best is clip or appliance therapy, which are usually given by your pediatric dentist. And two things that you can do at home is diet modifications and lifestyle modifications. Diet modification is anything that is over the counter packed food that is stored for more than 2 months, and it has an expiry of as long as 6 months to a year. Just say no to it. It is not good for you. It is loaded with a lot of sugar, a lot of salt, and this also has effect on the growth and development of the jaw bones. Instead, purchase anything and everything that has a short expiry or you have to consume in a short time span. It means that that food is healthy. Lifestyle modifications, you should be stopping all kind of gadgets except for your online schooling, and increase the physical activity at home. It may be in the form of yoga or skipping with a rope. If you have space around your house, cycling, jumping, and a lot of a small space. Even at home you can play a hopscotch, langdi, and teach old games that we used to play. Kids don't know nowadays what is sakli or what is langdi, and this games can be played in small space also. You don't need a big ground for that. So a lot of physical exercise. A child should have at least 1 to 2 hours of physical exercise every day. It is okay if your child misses on his online schooling as well. I'm not against schooling, but what I'm saying is it is okay if your child misses one class in between, uh, if he is not comfortable with his posture. See to it you get him a good chair to sit. Given the Corona times, this COVID is going to extend. We don't know how long and how long the online schooling is going to happen. So you have to, get a good chair and a good space for the good ventilated space for the child. The gadget should be at the eye level, and always see that there is a cushion behind the lower back of your child so that he does not slough, he does not sit like this. I'll just show you the postures with which kids usually sit. Some kids will sit like this, some will sit like this, some will sit like this. So you have to encourage your child. And when I say mouth breathing and COVID-19 pandemic, it is important to understand that mouth breathing affects the immunity of your child, affects the immunity of breathing. The air is not filtered. Nasal breathing is what filters the air. And especially when you wear the mask, mouth breathers usually have a choking effect, not the nasal breathers. Those who are breathing through the nose, even though they wear a good N95 mask, they will not have a choking effect, unlike the mouth breathers. So it is important for you to identify your child if he is having a mouth breathing and get him corrected or treated as early as possible. This is one child who had reported to us all the way from, western suburbs, and she was referred to us by an ENT. This child had, if you see the first picture on either sides, there's drooping of the back, the lower jaw is not developed, there's mid-face deficiency, the front teeth are visible, the lips are not touching each other. See the outline of the lip, there's something called as chappy or cracked lips, and the mid face is basically not developed. And if you see the pictures after we did the clip therapy and the exercise therapy, which ran for at least like 12 months to 15 months for this child, the mid face has really developed, the cheekbones are developed, the lips are lustrous. The child can now close the lips. You can appreciate it in this picture. The child can close the lips, whereas in this picture, the child is not able to. So all I have to say is, the first picture, the child is looking dull and expressionless, whereas in the second picture, the child appears very smart and a good facial appearance. This is another child she reported to us at 7.5 years of age, and this is when she turned 9. She had come to us with a chief complaint of uneven front teeth, but trust me, we did not do any treatment for the alignment of the teeth. We corrected the mouth breathing. We put her on a lot of tongue exercises. We put her on a lot of lip exercises, physical exercises, and the correction happened independently, irrespective of working on the teeth with braces. So the aesthetic outlook of the teeth is just a byproduct of the enhancement of the orofacial features. I am a pediatric and preventive dentist and an orofacial myotherapist. So our primary domain is to take care. We as pediatric dentists can really identify and help you with mouth breathing. And do share this video with your friends and alike, so that we can share more information and help create awareness about mouth breathing. You can download the BabyChakra app with my referral code Vivek. I repeat, my referral code Vivek, Vivek, and you can get access to this talk. Now let's take some few questions in the last few minutes. Jenny says, hi doctor, what is mouth breathing? So well, we have discussed, again to brief you, Jenny, mouth breathing is nothing but an abnormal way of breathing through the mouth instead of, breathing through the nose. My dentist told me mouth breathing will land my kid for braces. Is it true? Yes, Jenny, it is very true. Your dentist is, has identified the problem bang on. If you don't get it corrected now, definitely your child will need braces in future. So then we have, does mouth breathing, Lakshmi says, does mouth breathing change the shape of the face? Yes, if you have seen the pictures, you will be convinced that yes, it does change the face. How do we fix mouth breathing at night? This is by Mrs. Kapoor, and you need to identify the cause of mouth breathing. And once you have identified the cause of mouth breathing, your pediatric dentist can help you with some kind of clips and exercises. And is mouth breathing, Madhvi has a beautiful question, is mouth breathing linked to ADHD? ADHD is nothing but attention deficient hyperactive disorder. Yes, mouth breathing has been associated with ADHD, short attention span, because the complete oxygenation of the brain is not happening. When the child is breathing through the mouth, the the entire, all the lungs are not utilized, and the full lungs oxygenation is not happening. So the entire oxygenation of the brain is also not happening, and therefore the circuit keeps on breaking in the brain, and the child keeps on flipping between activities, and that is the reason why it has a short attention span. I think uh, we have answered a good amount of questions. So, so if any more queries, you can write to us. You can write to us on BabyChakra. You can write to us on drvivekjogani@yahoo.com, and I shall be happy to answer you. On behalf of BabyChakra, I thank you all for attending this session and making it worth a while. It was good spending time with you, and thank you so much.